Hello, my name is Dr. Caroline Grady. I'm a physical therapist with Cornerstone Physical Therapy. Today I want to go over a little bit of when to use an assistive device, whether that's a cane or a walker, how that can be used properly, and then the goal of using an assistive device. So the biggest thing that we use for either a cane or a walker is we use those to help make us walk more regularly. Whether you're having pain on one side or the other, you're having sometimes frequently after surgeries or after any sort of injury, we might use those to temporarily offload the joint to protect the joint, as well as to maintain that normal gait pattern so that we're not changing how you're walking or creating any other issues above or below where your injury has occurred. So I want to go over a couple things about specifically cane fitting as well as walking with a cane. And some things you can use with that. Unfortunately today I do not have a cane, so I'm going to be using this stick that we have. In Asheville, a lot of people too will use walking sticks as they're sometimes more comfortable using those in public versus using a cane. The biggest thing that you're looking for with a cane is that ideally the height is going to be occurring right at your wrist. Okay, so for me it would almost be right at the height of the end of my shirt here. That way I could hold on as I'm walking. That would give me some support. Okay, so that's one of the things you're going to look at. That might be different depending on each person, and that's something that a physical therapist could help assess. Is your height of your cane appropriate for you or not? If you are walking with a walking stick, that still is going to give you some support to help offload the joints a little bit. But if you're using a cane more with balance and a little bit more weight bearing, having it lower is going to allow you to put more pressure through it without creating issues into your shoulder or into your back with leaning on it. The other thing is that you're going to want to keep the cane on the opposite side of where you're having any issue. So let's say I have some difficulty in this knee. I'm going to be using my cane on the other side. That way when I step onto my painful leg, I can put more pressure through that arm with the cane so that less pressure is going through my knee. Okay, I'm going to step forward with the cane and then take a normal step onto my uninjured side. And you would continue with that motion. Okay, so that's when you would use a cane and the height that you would want it. If you do have issues going on both sides, sometimes trying out which side works best for you can just be a process of trial and error. But if your symptoms are all on one side, be sure that you're using the cane on the other side to help offset some of the load and some of the pressure going through the joint. A lot of times too, patients will ask when should they be using a walker or when they should be using a cane. And the short answer to that is you want to use the least restrictive assistive device. So by that I mean typically the one that is easiest to move around. So normally that would be a cane, but that also gives you the support and the stability to maintain a normal walking pattern. So if you are able to walk more efficiently and walk with less discomfort and less pain using a walker, sometimes that can give you more support than trying to walk with a cane, which is causing you to create other issues by leaning too much on the other side or not being able to walk as far. So typically we would want you to work on reducing the level of demand that you have on the assistive device. But first and foremost, we want to make sure you're able to maintain your consistent walking pattern and able to do that comfortably and for a period of time so that you're not having to create other problems up or down the chain. If you have any questions about your assistive device or when those could be used, when they're appropriate, you can always give us a call and we will go over that in more detail specific to your case. All right, thank you very much.